Hello everyone, my name is Emilie LabrancheE and I'm a second-year medical student at NHRC University. Today I'll be presenting findings from a collaborative quality improvement study titled Reviewing Paramedic Practice Between Urban and Rural Communities in Northwestern Ontario. This project falls under Theme 4, Humanities and Social Sciences for the Northern Health Research Conference. Before I begin, I want to disclose that I have no relationships with for-profit or not-for-profit organizations, and that this project has received financial support from NHRC University in the form of a Summer Student Research Award in 2024. Pre-hospital emergency medical service, or EMS providers, often represent the first point of contact between patients and the broader healthcare system. This vital phase involves the prompt delivery of medical interventions to stabilize patients before they reach a healthcare facility. Effective pre-hospital care is indispensable in improving patient outcomes, as it directly impacts mortality and morbidity rates associated with acute illness and injuries. Given the unique geographic and demographic challenges in Northwestern Ontario, we wanted to better understand how paramedic practices differ between urban and rural regions. The goal of our study was to identify specific areas where education and support could improve pre-hospital care. To explore these questions, we conducted a retrospective review using data from the Northwest Region Pre-Hospital Care Program's call review system and the ACE tool database. We analyzed call reviews from 2020 to 2023, drawing from all 5 paramedic services across the region, including 1 urban and 4 rural. Each call review was categorized by paramedic service, primary theme, sub-theme, and outcome to allow meaningful comparisons between services. In total, we reviewed 131 call reviews and identified 219 primary themes and sub-themes. Superior North District EMS was the service with the highest rate of call review at 14.63 per 10,000 calls, nearly twice the rate of the second highest service. These rates are shown in Table 1. The most common sub-theme was medical arrest, which was present in 34% of call reviews. Drug administration was second at 15%, and problems with base hospital communications for orders and treatment advice accounted for 11%. This is shown in Figure 1. From these 3 most encountered sub-themes, proportions shown in Figure 2 were created to highlight that for medical arrest, Superior North District EMS had a rate of nearly 2 times higher than the other services. For drug administration errors, Superior North District EMS and Rainy River District paramedic services had rates that were nearly double that of the other services. For base hospital patching errors, Nowit-Kemagwaning EMS and Superior North District EMS had rates that were nearly double that of the other services. When looking at call review outcomes in Table 2, 19% led to paramedic remediation, and 2% resulted in clinical deactivation. Strikingly, errors in cardiac arrest management were involved in 64% of those requiring remediation and 100% of deactivation cases. For Superior North City EMS, the only urban service, both primary care paramedics, or PCPs, and advanced care paramedics, ACPs, provide services within the area. Of the call reviews that occurred for this service, 62% of them involved ACPs, while the remainder involved PCPs only. Of the 31 call reviews that included cardiac arrest as a primary theme, ACPs and PCPs were both involved in 71%, while only PCPs were involved in 29%. Of these call reviews related to cardiac arrest, the rate of call reviews involving PCPs versus ACPs is shown in Table 3. This demonstrates that ACPs were more frequently involved in more complex cardiac cases. In conclusion, these results have future implications. They suggest that challenges in cardiac arrest management, drug administration, and base hospital communication are key areas for improvement across both urban and rural EMS. These findings also highlight the need for targeted educational interventions, programs that address not only general clinical skills, but also the realities and resource limitations specific to rural and remote practice. Thank you to the Northwest Region Pre-Hospital Care Program, NHRC University, as well as the Thunder Bay Emergency Physician Local Education Group for making this study possible.